When I was in high school, I was looking into other health professions and I was unsure about nursing. I always wanted a job where it was changing on a day-to-day basis. I couldn't see myself sitting at a computer all day doing the same mundane things. And I was tossing up with other careers like nutrition and dietetics and nursing, but what made me really choose nursing is the fact that I can travel with the degree and everything. That seemed really appealing at the time. I had family members that were in at the Mater Children's Hospital, actually, some of my cousins, and I used to go visit them, and I really loved how the nurses used to work, and I was always intrigued from a young age, what they do on a day-to-day basis. So it really led me into that healthcare industry at the time. So went with nursing, and now I work in the emergency department. It changes every 2 minutes, so it's exactly what I wanted. I've worked at many hospitals across Brisbane. I've always lived in Brisbane, and I know that Mater has a great reputation. I think anyone who lives in Brisbane would know that. So it really led me to work here, and I did prac here as a student, and I absolutely love how the team orientation works around in the hospital, and I loved that. And in comparing the grad programs, I found, and I trusted that Mater would support the grads. I was so nervous starting as a student. I used to joke that you'd have to drag me in January to go start. I was so nervous. So I really wanted a program that would support and nurture the grads, I guess. My best day would have to be a day where I spend having a real good conversation with a patient. I find you come home and you're so happy because you hear about someone's life story, and coming from a very basic and healthy family, hearing someone else's life story and that they've been through so much turmoil and things, it's really interesting, and it's nice to reflect upon that in a way. I think most graduates would say your worst day is when unfortunately someone passes away, and as a grad it can be really stressful, your first patient that does pass away. But then again, you go home, there's been plenty of times I've gone home in tears and my poor parents have had to look after me, but you reflect upon it, and I think the big thing is it's a privilege to be invited into that person's life at that point of time when they're most vulnerable. And yeah. So at the beginning of the grad program, we had a really good 2-week intensive, or 1-week intensive orientation. Went through a lot of packages and things like that, what we could expect from the year, which was really great. And then we had 2 weeks orientation on the ward, and that just made us feel so much comfortable. I felt that it made me feel so much more comfortable and ready to tackle on the year. And throughout the year, we've had great educational opportunities. We've had in-services on the ward, study days, which go through competencies and PIC lines and central dressings and all things that you come across on the ward on a day-to-day basis. There's also other opportunities, educational opportunities, to go for a day with the wound care nurse or the urology nurse. So if you want to go into those kinds of fields, you can spend a day with them, and there's always more education things that you can follow up on and do. I'd say the main thing is be prepared for stressful situations, because they're definitely going to occur in the year, and be prepared for tears, but then there's so many happy times that you'll come home from work, you'll just be so excited from what you've seen and the people you've met and things, and develop a good support network, as be your friends or your family, because you need someone there that you can rely on. When you come home after a bad shift, you need to be able to discuss with someone what's happened. I've stayed up countless nights thinking about those events. It goes through your head all the time, but you do learn a lot, and in a way you do come out stronger, I guess.